Dear students, in this module, we will be covering one of the important issues that the elderly confronts over a period of time as the age increases. It is dementia and Alzheimer's care. If we look at the word dementia, describes a set of symptoms that may include memory loss and difficulties with thinking, problem solving, or language. These changes are often small to start with, but for someone with dementia, they have become severe enough to affect daily life. A person with dementia may also experience changes in their mood or behavior. What are the symptoms of dementia? Each person is unique and will experience dementia in their own way. The different types of dementia also tend to affect people differently, especially in the earlier stages. Other factors that will affect how well someone can live with dementia include how other people respond to them and the environment around them. A person with dementia will have cognitive symptoms, that is to do with thinking or memory. They will often have problems with some of the following symptoms. Day-to-day memory, for example, difficulty recalling events that happened recently, concentrating, planning, and organizing, for example, difficulties making decisions, solving problems, or carrying out a sequence of tasks such as cooking a meal. Other aspect is about language, for example, difficulties following a conversation or finding the right word for something. Visuospatial skills, for example, problems judging distances such as on stairs and seeing objects in 3 dimensions. Other aspect is orientation, for example, losing track of the day or date or becoming confused about where they are. What are the differences between normal forgetfulness and dementia? Forgetting things is common at all ages. For example, where did I put my spectacles? I met an old friend the other day, but what was her name? The other aspect is dementia is suspected when there is a progressive memory loss affecting the person's daily life and the people around them. What causes dementia? One is Alzheimer's disease. This is the most common cause of dementia. Problems with day-to-day memory are often the first thing to be noticed, but other symptoms may include difficulties finding the right words, solving problems, making decisions, or perceiving things in 3 dimensions. Vascular dementia. If the oxygen supply to the brain is reduced because of narrowing or blockage of blood vessels, some brain cells become damaged or die. This is what happens in vascular dementia. The symptoms can occur suddenly following one large stroke. Mixed dementia. This is when someone has more than one type of dementia and a mixture of the symptoms of those types. Dementia with Lewy bodies. This type of dementia involves tiny abnormal structures, Lewy bodies, forming inside brain cells. They disrupt the chemistry of the brain and lead to the death of brain cells. Frontotemporal dementia, which includes Pick's disease. In frontotemporal dementia, the front and side parts of the brain are damaged. At first, changes in personality and behavior may be the most obvious signs. Depending on which areas of the brain are damaged, the person may have difficulties with fluent speech or forget the meaning of words. Dementia is also an important public health priority for intervention. Way back in 2008, the World Health Organization declared dementia as a priority condition through the Mental Health Gap Action Program. Prevalence and incidence projections indicate that the number of people with dementia will continue to grow, particularly among the oldest world, and countries in demographic transition will experience the greatest growth. Dementia can affect a person in different ways, and progression of the disease depends upon the impact of the disease itself and the person's personality and state of health. Dementia can be divided into 3 stages. For instance, early stage, first year or 2, middle stage, second or to fourth or fifth years, late stage, fifth year and after. These periods are given as an approximate guideline, and not all persons with dementia will display the same symptoms. What is the size of the problem of elderly who are experiencing this dementia? The total number of people with dementia worldwide in 2010 is estimated at 30.6 millions, and it is projected nearly double every 20 years, to the extent by 2030 the number is going to be 65.7 million, and by 2050 it is going to be 115.4 million. The total number of new cases of dementia each year worldwide is nearly 7.7 million, implying one new case every 4 seconds. It itself voluminous number of people entering into this, and it is continuously growing, which clearly indicates the attention that is required on a priority basis to see that the quality of life of the elderly, especially those who are suffering with dementia, can be taken care of. As we discussed, some of the important symptoms that the Alzheimer's disease the elderly people face is that they lose new information, there will be recent memory worse conditions, the problems finding words, misspeaks, more impulsive or indecisiveness, they get lost, notice changes over 6 months to 1 year is another important issue that comes out. Also issues related to memory loss. What are the losses? Immediate recall, attention to selected information, recent events, relationships. Then there are preserved abilities like long ago memories, confabulation, emotional memories, motor memories. These are all important for us to understand in the case of Alzheimer's disease. There are different stages of Alzheimer's diseases. Alzheimer's disease typically progresses slowly in 3 general stages, namely early, middle and late. Early stage Alzheimer's. In the early stage of Alzheimer's, a person may function independently. He or she may still drive, work and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. Next is middle stage Alzheimer's. This is typically the longest stage and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. You may notice the person with Alzheimer's confusing words, getting frustrated or angry, or acting in unexpected ways, such as refusing to bathe. Damage to nerve cells in the brain can make it difficult to express thoughts and perform routine tasks. The final is the late stage Alzheimer's. In the final stage of the disease, individuals lose the ability to respond to their environment, carry on a conversation, and eventually control movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills worsen, significant personality changes may occur, and extensive help with the daily activities may be required for this section of people who are experiencing Alzheimer's at that stage. How are we going to manage those who are experiencing Alzheimer's disease? Treatment of Alzheimer's disease takes on a systematic approach. First, if there are medical conditions that make Alzheimer's symptoms worse, that illness needs to be managed. There are several medications such as alcohol, sedatives and antihistamines that can also aggravate AD, and these must be identified and removed or switch to alternative medicines. There is a need for creating public awareness about dementia and Alzheimer's cases in India. It is very low as on now, mainly because 90% of cases of dementia are undiagnosed. It is seen as a normal aging, not as a disease. Dementia is a hidden problem, a lot of stigma attached to it. Few health or social care services exist to attempt in terms of medical attention to those who are suffering. The other aspect is low levels of training of staff is another aspect which requires attention. People do not seek help in time, and also there will be so many issues in taking treatment. What is the economic impact of this disease? The global societal cost of dementia and Alzheimer's. Dementia treatment is expensive. The financial costs of managing AD are enormous. The cost of illness is high in terms of both public and private resources. Families and caregivers who are required to provide care and patients affected by dementia also pay a high price in terms of their quality of life. There is a strong need to increase awareness about dementia and Alzheimer's because this is important to help families, mainly to understand unusual behavior among the elderly, to manage their feelings of blame, guilt and anger, to gain possible access to assessment and diagnosis, to access care and support services if available to them. What are the post-diagnostic care and support services that are needed for these people? For the person living with dementia, there is a need for person-centered care and support. The other aspect of holistic treatment, the regular reviews of the condition of these people. As far as for the carer is concerned, it is a need to assess their needs, then regular reviews are also to be attempted. What type of support and to whom it should be rendered? Family and friends have to play an important role. There requires a sympathetic listening about them. Information and education campaigns have to be carried out. Respite care is also another important aspect which requires for caregivers. Financial and practical help is very much needed to take care of these people. A named professional person to turn to all times is a need of the hour. What about care of the person living with dementia and Alzheimer's? It maintains independence, healthy lifestyle, include and engage them, regular checkup of physical state, vision, hearing, feet, drugs, none or as few as possible. They are all very required for care of the persons. How best we can prevent and postpone the dementia and Alzheimer's? It's good to maintain for the heart and good for the brain. This will be as a preventive measure that is required. Cut smoking habits. Need regular exercise, which is treated as the cheapest drug in the society. Moderate alcohol intake if that is required. Healthy diet, that is very important. All will reduce risk of dementia as well as many of the other physical and mental illnesses. Dementia and Alzheimer's can be treated with the proper knowledge, with adequate skill building, with good commitment, with flexibility, with practice, with adequate support, with compassion. These are certain things which are very much required in our society, and also the projections clearly shows that we need to emphasize on a regular way of understanding these cases and to pay attention for them. Caregivers and their issues. As we have seen that elderly issues, as age advances, their issues becomes more and more complex. Furthermore, their dependency on other members will increases. In this context, role of caregivers are very important. And given the low fertility and also the changes that are happening in the family and also the migration that occurs among the young members, more and more issues related to caregivers started assuming its importance. One of the important aspects which we need to know is that how best caregivers' life, especially their quality of life issues, can be addressed so that they will take care of the dependent elderly in their families. If we look at the number of older adults in the past few years worldwide, the continuous growth has resulted in increasing in their chronic disease rates and further impacted in their dependency. Thus, a greater number of older adults are dependent on accessing healthcare professionals and settings. Family members have been shown to play a very important role in care of the elderly. According to the Institute of Medicine in 2008, it has been defined that family members, friends, and other unpaid caregivers provide the backbone for much of the care that is received by older adults. Yet, their role is often underappreciated, and many family caregivers support their loved ones at significant cost to their own physical, emotional, and financial well-being. In this context, we need to understand that caregivers also experience a lot of stress and strain while extending care to their elderly relatives. Dowd in 1975 and in 1980 has mentioned that among the first to use the exchange theory in social gerontology is Dowd, and he mentioned that it advances the argument that aging affects exchange relationships in the sense that people desire to profit from social interaction with others, and that profit consists of a perception that the reward coming from the interchange outweighs the costs. The family is the major source of caregiving. Coward 1992 reported that an overwhelming proportion, to the extent of 85% of the older people surveyed in that study, received assistance from their family, 10% have received assistance from friends, 15% have received assistance from paid household workers, and 13% received assistance from social service agencies. Family members tend to provide personal care, while friends tend to provide emotional support. Older people tend to feel that family members are obligated to provide personal care and do not expect much personal care from friends. Silverstein and Litwak, way back in 1993, have developed a topology of caring that included two different categories of support tasks performed by the primary caregiver to elderly parents: household tasks and social emotional support tasks. These tasks were further subdivided into 4 patterns, including isolation, obligatory, modified extended, and traditional. Although daughters and spouses continue to remain the primary caregivers of older adults, the division of labor by gender, along with the different family and kinship structures brought about by diverse remarriages and step family formations, which increased the complexity of who should take on the caregiving role. What about family caregiving? Family caregiving may include a variety of supports and services that enhance or maintain older adults' quality of life in terms of emotional, social, and spiritual support. Assistance with decision making related to healthcare, financial matters, and lifespan planning is another issue that requires attention. Assistance with physical tasks such as bathing, dressing, or walking, and such other issues needs attention from the caregiver's point of view. Support in navigating and negotiating health and social service systems, such as dealing with health and long-term care insurance, arranging and overseeing paid helpers in the home, communicating with healthcare professionals, or advocating for quality care and services. These are all issues that deserve attention. Assistance with practical matters such as housekeeping, processing paperwork, or going to medical and other appointments related to finance support, including direct financial assistance and help with bill paying or shared housing issues also deserves. In Indian context, the perspectives on caregiving deserves our attention. In India, the family has long been viewed as the primary site of age. For instance, way back in 2003, Rajan and Kumar have highlighted the Indian perspective of caregiving. The ideal Indian joint family includes 3 or more generations living together, with the patriarch being the head of the household. A joint family household could have grandparents, aunts, uncles, nephews, and nieces all living under the same roof. This family structure has historically served as a safety net for the elderly. Irrespective of their health status, although the original form of joint family structure has changed, and intergenerational household arrangements, that is, living with only adult children, preferably the son, continues to be the dominant living arrangement for a majority of elderly Indians above the age of 60, which clearly reveals that there is a specific pattern in the living arrangement which have a bearing on caregiving also, especially given in Indian society the preference for son plays a dominant role, so that caregiving, especially by the daughter-in-law or by son, plays a dominant role in care of the elderly. In the study of 60 plus age group conducted by UNFPA in 2011 clearly shows that a large majority of 70% reported that they are living in intergenerational households, which clearly strengthens our argument that the institution of family is most preferred by the elderly in their living arrangement, which has a bearing on their caregiving issues also. Caregiving, also termed as seva, that incorporates components of respect, care, love, moral and spiritual indebtedness and obligation, is a family responsibility passed on from one generation to the other, with usually the elder son, although there are regional variations, taking upon the primary responsibility of aging parents. In the context of India, sons represent old age security. That is why in Indian context, caregiving has a specific dimension where the role played by son in the care of elderly is an important issue that needs the attention of program managers and also policy makers. There are different challenges in informal care and also family care. Care among the descriptions of informal or family caregiving, one has sustained the test of time. For instance, Horwich in 1985 has categorized informal care as involving 4 important dimensions. Direct care, it includes providing assistance with bathing, dressing, managing medications. Emotional care, that is providing social support and encouragement. Mediation care, negotiating with others on behalf of the care recipients. And financial care through gifts or service purchases. These are the domains in which we need to understand that there are different categories of caregiving exist in the family setups. Family caregiving for frail elder reflects that these challenges also are to be documented. For instance, for an elder, informal care usually is initiated around the tasks of daily life, such as helping with meal preparations, housekeeping, household maintenance, and transportation. Recognizing that elders often have at least one chronic condition, the management of the chronic disease regimen adds varying degrees of complexity to these tasks. In that context, when we talk about family caregiving, it's very important that given the multiple vulnerability that the elderly are experiencing in our society, it ultimately influences the caregiving and furthermore the caregiver's role is increasingly seen in this context. Furthermore, it is very important for us that given the profile of the caregivers, also it becomes very difficult for them to devote more time in terms of caregiving. The planning for caregiving is another important aspect that needs our attention. Many people have the perception that caregiving is a natural and emotional response by a family member to take care of another family member who has a chronic health problem. While helping to care for an aging family member certainly plays an important role, it should begin with planning for aging at an earlier stage of life and continue during the later stage when critical needs arises due to chronic health conditions. What are the problems of caregivers? In 1994, Gottlieb, Calvo and Frebon found the following risk factors which have negatively affecting caregivers' abilities to manage both their work and also caregiving situations, like co-residence with the elder, having more elder care crisis, providing Alzheimer's and dementia support, providing managerial assistance with finances and community services. Also, we need to understand that there are certain negative effects on personal well-being. Most studies reveal that stress, burden, and negative health effects of caregiving. Research has shown that caregiving can put caregivers at increased risk of becoming depressed and feeling stressed, strained, exhausted, or fatigued, and reporting more health problems. For instance, diseases like arthritis, insomnia, diabetes, obesity, weight gain. Besides the stress associated with physical exhaustion and deteriorating physical health, previous sibling or parental conflicts may arise once again, adding to the caregiver's psychological distress. Furthermore, the demands of caregiving may cause some caregivers to cope by restricting their social contacts with friends, neighbors, and others, resulting in a loss of social support. What are the needs of working caregivers? Given the profile of caregivers are changing, young caregivers especially have to see that if they are couple, they both will be involved in working, so that they have to see that their family will get adequate financial support. When they are in that situation, they have to take both sides of one section where the elderly have to be taken care of, the other side where their own children who will be in the school going age. Then furthermore, they have to devote more time and resources in taking care of these two generations. In that context, we need to understand the specific needs of the working caregivers. For instance, flexibility. Working caregivers routinely note the importance of both flexible work hours and being able to take unscheduled time off when needed to handle caregiving responsibilities. Information and assistance. The needs of working caregivers vary according to the care situation and the needs of the care recipient. Regardless, however, just as do their non-employed counterparts, working caregivers need information on the community services that are available to support the needs of elders. Most caregivers of elders have had little or no previous experience either with providing care to an elder or with negotiating the aging service systems. The other dimension is about emotional support. Emotional support for working caregivers can come in the form of support from co-workers and supervisors at the workplace, support from other family members, and support from friends. Other tangible assistance also is the need of the hour. Working caregivers need help with legal, financial, and health insurance matters and the paperwork associated with this. Helping an elder manage the paperwork associated with his or her medical care is a daunting task. Similarly, securing and completing the legal forms for durable power of attorney, wills, reverse mortgages, and the like can be really frustrating and also time consuming. These are the important issues that require from the caregiver's point of view, which needs a priority attention. Given the high population aging that are experienced in our society, caregiving is important and also requires high attention on the part of everybody. Thank you.